There are some differences in sequence for a single rescuer of a child, depending on whether the child was found in arrest or the arrest was sudden and witnessed. If you do not witness the arrest and you're alone and have no mobile phone, you should shout for help, but perform 5 cycles of CPR before you leave the child to activate the emergency response system and get a nearby AED. Then, return to the child to perform CPR and use the AED. However, if you are alone without a mobile phone and you do witness a child suddenly collapse, you should leave the child to quickly activate the emergency response system and get a nearby AED, and then return to the child to perform CPR and use the AED. Of course, when there are multiple rescuers, the first rescuer should remain with the child to begin CPR, while other rescuers activate the emergency response system and retrieve the AED. Now, we'll talk about the skills for 1 and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse, followed by infant compressions, and then we'll go on to the breaths with the bag mask device. Finally, we'll combine those for practicing 2 rescuer infant CPR. To check an infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder. Then, when attempting to feel the pulse, press the index and middle fingers gently on the inside of the upper arm for at least 5 seconds and no more than 10 seconds. If there is no pulse, or if the heart rate in an infant or child is less than 60 beats per minute, with signs of poor perfusion despite adequate oxygenation and ventilation, begin compressions with the ventilation. To begin CPR, place the tips of 2 fingers or 2 thumbs on the sternum in the center of the infant's chest, just below the nipple line. Be careful not to press on the bottom of the sternum. With your hands in the correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. And the rate needs to be 100 to 120 compressions per minute. After each compression, allow the chest to recoil completely. We'll pause here and practice.